For small cell lung cancer, we've tried many different therapies over the years. And what we've seen is that chemotherapy and immunotherapy really is by far the best chance a patient has to achieve long-term survival. And this is a cancer that moves very quickly. It is unforgiving. And so if we have delays in starting that treatment, unfortunately, a lot of times patients are not well enough to receive any therapy. Once we make a diagnosis of small cell lung cancer, we need to start treatment very quickly, or else that patient will become too sick to receive any therapy. Complementary medicines, herbal medications, holistic approaches, I think are very interesting, and a lot of times they do have clear biologic effects. We believe these medicines and procedures and treatments are doing something, but we don't fully understand it yet. We're trying to. Right now, those medicines should not delay the standard treatment for small cell lung cancer because we may only have a small window to start treatment. And it's very important when we look at a lot of these other medicines that we examine whether or not they have interactions or interfere with the treatment that we're giving. There are some medicines that are actually very effective. Medicines that sort of remove toxins from the body, antioxidants that can really help remove a lot of the toxins or harmful things from the body. But when we're talking about cancer and cancer treatment, remember that the medicines we give are, in a way, toxins themselves. And so if we counter that with a holistic or herbal medication, it may undo what the treatment is doing. So we may actually be doing something detrimental to our patients. Right now, I think the important thing is to talk openly with the doctor. But for small cell lung cancer, it is really important that we start an effective therapy very quickly. Yeah, if we look at a lot of the traditional medicines, if the medicine doesn't do anything, I don't care if you receive it. If the medicine has no effect on the body, does nothing at all, you can take as much as you want. I'm only concerned if it actually does something. And with a lot of the traditional Chinese medicines, they do things. They have effects on the body, but they may not interact very well with a lot of the Western medicines. So if someone is taking something that does not do anything, it may be a waste of money, but I don't really care from a medicine standpoint. I'm only concerned if the medicines are doing something. And for a lot of Chinese medicines, they are doing something, but it may not be what we want to do, and it may directly antagonize, it may directly interfere with a lot of the medicines that can help. I think it's really important that we talk more about cancer. Cancer is very common, and cancer is changing. We're seeing cancer in people with no risk factors, in people that have never smoked, in younger people. We still see a lot of cancer in older patients as well, but we don't talk about it a lot. If we don't talk about it, we develop this stigma where if we're worried about cancer, we may not seek medical care because it's not something we want to talk about. It's something we're ashamed of, and we shouldn't be. We have to understand that all of us that are walking on this earth are at risk for cancers, including lung cancer. And if we develop a lung cancer, it's not our fault that it happened. It's not because of anything we did that was bad or wrong. It happens to good people all the time. And the more we talk about it, the more we can encourage people to seek care early. And when I look over my patients, the patients that do the best are the patients where we find these cancers early and where we treat them early. And where we have the worst outcomes are people that know something's wrong, but don't seek medical care because they're ashamed. And we have to understand that that's only going to hurt everybody. It's only going to make things worse. That if we can find these cancers early and treat them with newer, more effective medicines, that a lot of times we can get them under control so that patients can go back to their normal life, where they can continue to work, to help with the family, to help around the house. Whereas if we don't treat it, then those patients get sicker and sicker, and we're not able to do as much and not able to help. So I think an important aspect of these programs that you run is really talking more about cancer. It can affect any of us. Any of us can be diagnosed with cancer at any point.